Hello, everybody. I am Melanie Joy Pensack, and I am here to share today more about grief and chronic illness. I'm going to take a minute to share the screen now. Okay, so this talk is called Honoring Loss and Transforming Grief in IBD, CIRS, and Chronic Illness. Special thanks to Ali Manzella also for her collaboration on this talk. What are the objectives for today? To share a variety of experiential tools and resources that chronic illness IBD and CIRS IBD patients can utilize to understand, process, and move through feelings of grief. To emphasize the importance of recognition, validation, and community in processing grief. And to educate how grief has compounding immunologic, physiological, and emotional impacts on chronic illness patients. A little about my background. I am a certified speech and language pathologist for 20 years, a certified mindfulness teacher for a decade, a grief educator and peer-to-peer support, shoemaker proficiency partner, founder of Meditation for CIRS, hostess of the Heart of CIRS podcast, and a recovering CIRS TICO patient. How did I get interested in grief? So in my own CIRS journey, I grieved the loss of body function, the loss of support systems, physical belongings, finances, my future, independence, and identities. There are limited resources out there for the intersection of grief and chronic illness, grief and CIRS, and grief and IBD. I want us to ask what type of grief support helps patients feel validated and seen. I'm curious what types of grief support help patients process and move through grief. And I began exploring really experiential methods of processing grief in my own experience out of necessity. I want to share a little bit about my timeline to give you perspective on how I came into this work. In 2000, I had a series of deaths in my family. My mother died at age 18, and that was very disorienting and really my first experience with the grieving process. In 2015, I began practicing mindfulness meditation and teaching classes. 2019 became a certified mindfulness teacher. And then 2020, we really started to have global grief. So lived through COVID, lived through a lot of environmental grief related to fires where I was in California. That's where I had a mold exposure. 2021 was my CIRS priming event. It was the second Moderna vaccine. And 2021, in that fall, I had multiple hospitalizations, rapid health decline, near-death experience. And so I was really grieving my health, my life in that process. 2021 to 2022, I was bedbound and had a lack of independence, a CIRS diagnosis in April of 2022, more grief around receiving that medical diagnosis. And then as I began to heal in 2023, I started to teach mindfulness to CIRS patients. In spring of 2024, I got additional diagnoses. I was not healing as quickly as we had hoped and got diagnosed with multiple tick-borne co-infections, including anaplasmosis, Bartonella, tick-borne relapsing fever, and indicators of Lyme and rickettsiosis. So there was grief around this now extended timeline of healing. In fall 2024, I became certified as a grief educator with David Kessler, who's very well known in the grief community. And that's when I put together my first grief course for CIRS patients. And now ongoing, I am collecting data with CIRS patients, exploring grief experientially in community, and working with chronic illness patients one-to-one on this area of processing grief. So the big question is, how do we help reduce the mental, emotional, and spiritual suffering for patients experiencing grief? Here, I think, is a really interesting photograph, Albert Borghi's sculpture Melancholy, that shows this big hole in the chest, just like something is missing, and that downward posture. I think a lot of people that are going through grief will recognize this position and this sentiment. Let's talk a little bit about in what areas patients experience loss. So prior to diagnosis, they might sense something isn't right or something's missing in their health. There may be a longing for someone who understands what they're going through. There might be grief at diagnosis. So this could be the sudden onset of really life-changing, disorienting symptoms and diagnoses, missing optimal health, being able-bodied. People might start to grieve the time they've lost jumping from doctor to doctor, or the money they've lost trying to fix downstream symptoms. Could be at the time of a medical surgery as well. There can be sense of grief around family and friends. So just missing activities with people that they love, having to give up attendance at events due to a location or body energy or the foods that will be there. Sometimes family, friends, and partners will disappear in the process. Another area where there's a lot of loss is when people wake up to the dysfunctions in the systems we live in. So when learning about chronic illness, IBD, grief can arise when realizing the flaws in the medical system, the insurance system, the financial systems, and the building systems. It can feel like everything is really working against somebody healing. And people can be grieving their free time. So missing out on many things that they used to love and missing out on not having to consider so many details, missing out on activities outside of cleaning, researching, learning about the illness. There can be grief and loss around employment for those that need to give up work suddenly or over time, those who have to change careers or work from home. There can be a sense of loss around dreams. So maybe realizing the timeline of owning a home or traveling or starting a family, adopting a pet, meeting milestones has to shift because of the arrival of IBD, CIRS, chronic illness. There's grief around physical abilities, so missing exercising, activity, sports, traveling, driving, fully participating in everyday daily activities and intimate activities. There can be grief around food enjoyment. So missing freedom in eating and challenges with ongoing management of food, grief around food sensitivities and that limited diet. People can feel grief around their creative expression. So sometimes there's just no extra energy to create. They feel grief around participating in hobbies that they used to love, and they might not feel like doing their hair, or they might miss just playing with fashion and appearance. There can be loss around financial security, savings, credit score, physical objects for those that have a situation related to a water damage building or a home. They might have lost a home, an apartment, objects, photographs, sentimental items, and mental health. So really missing their optimism or their personality, that loss around when was the last time that I laughed, or showing up in a way that they would like to for others. Here's a quote I love by Jamie Anderson. Grief, I've learned, is really just love. It's all the love you want to give but cannot. All the unspent love gathers up in the corners of your eyes, the lump in your throat, and in that hollow part of your chest. Grief is just love with no place to go. So many times people feel such grief and a sense of loss around the things that they really love. And I often try to point people to this in their recovery and grief processing, that if you didn't love it so much, you wouldn't miss it so much and you wouldn't grieve it so much. And it's actually important to recognize this because then you can use that deep love to place importance on something similar moving forward in your life. So if you grieve the loss of that particular job that you loved, how can you bring that type of employment back in as you recover? What is grief? So grief is a natural emotional response to losing what you love. And it's a deep sorrow and distress experienced when something or someone important is taken away. It's most often associated with the death of a loved one, but grief can arise from other significant losses. So IBD, CIRS, chronic illness fits into the major life change category. Grief isn't just emotional. It can impact someone mentally, physically, socially, and spiritually. And it's deeply personal and unique to everybody. There's a couple common definitions of grief that I'll share. Grief is a multifaceted response to loss, particularly the loss of someone or something with whom or which a bond was formed, and encompasses emotional, cognitive, physical, behavioral, social, and spiritual reactions. Quite complex. One of the most recognized theoretical frameworks of processing grief is Kubler-Ross's 5 stages, which really conceptualizes grief as progressing through denial, anger, bargaining, depression, and acceptance. And while this is very influential, this model has been critiqued because it implies sometimes there's a linear or universal pathway that everybody experiences grief, and it doesn't always reflect individual variability. I will say that many people will go through parts of that framework, but not everybody experiences all of those or in a linear fashion. It's more of a cyclical spiral experience. You go in, you go out, you go deeper, you come out. Contemporary grief research emphasizes how grief is non-linear and influenced by personal, cultural, and contextual factors. The dual process model of grief, for example, describes more of an oscillation, as I just described, between loss-oriented and restoration-oriented coping processes. There are different categories of grief that you may notice or you might notice in your patients. So acute grief is when the loss or change has recently happened, very recent around belongings, home, abilities, and money, etc. Early grief would be the first 2 years after the loss or the change. Mature grief shows up across a lifetime. So I might look back and feel sad about 3 years of my life that I couldn't be with friends at different times. And that might show up at a wedding when I'm thinking about that period of time. Anticipatory grief, it can be before the ending change or event. So grief that shows up before having to leave that house or change schools or leave that job. Mass grief is suppressed and it really isn't able or allowed to be processed naturally. This might actually be necessary at times in the state of acute stress when there are situations that need to be handled immediately. And it can also be extended because of societal expectations or just a fear of processing and exploring the grief. Complex, complicated grief is when grief is very severe and long lasting, and that prevents people from moving on with their life in small ways. It can impact physical health, relationships, and ability to function in daily life on a much deeper level. What feelings are associated with grief? So grief really shows up as many different feelings in the whole process. And you'll see in this ball of grief over here that we have a tangled group of emotions. This is a concept from Greek counselor H. Norman Wright, and there are many things mixed together. So people are often surprised that they're grieving because they feel like they should be one way. And in actuality, when you start to talk to them and they process, they realize, well, I'm angry and I'm appreciative, or I'm sad and I'm feeling a deep sense of hope. But there can also be despair, periods of apathy and numbness, loneliness, betrayal, intense rage, sense of distrust or helplessness. And that can be sprinkled in with other times where they're feeling a deep sense of love. As we mentioned, grief's related to love. People might be accessing how much they appreciate the people around them or what they do have in the contrast of grief. Feelings often flow between anger and hope, sadness and peace. It's a fluid experience. What are some ways to work with grief experientially? So for some, talk therapy, counseling, or grief peer one-to-one support is the main modality. And a peer one-to-one support just means somebody that's also gone through the grieving process and has some training in grief. Others might need or gravitate more towards activities which help to process deep emotions somatically in the body without necessarily having to talk directly about the grief, because it can be hard to describe and access at times, and that can put more pressure on people. So things like experiential role play, improv, writing, journaling, music, guided meditative exercises, time in nature, art like drawing and painting, rituals to create a daily structure, ceremonies to honor, and somatics like Qigong, Tai Chi, yoga. These can all be experiential ways to move the emotional life. Some work in small groups and find that helpful to process the experience of grief. And for some, really a combination of individual support and community support is helpful. What does the research say around grief? So groups and community offer emotional relief. It supports the individuals that are grieving, providing a communal space where participants can share experience, process emotions, find that mutual commonality is so important, I've seen in the process. Experiential role play and improv really fosters a safe environment for individuals to explore and express emotions associated with grief. Writing and journaling, structured writing sessions reduce traumatic grief symptoms. In terms of music, this can aid in emotional expression, memory processing, coping strategies. And meditation and mindfulness reduce symptoms of depression and anxiety, decrease rumination and emotional reactivity, and improve mood and emotional regulation in people experiencing grief. One method I often teach people is the RAIN method for working with emotions, where you R, recognize or name it, A, allow and accept it, I, investigate the feeling, and then N, nourish yourself afterwards. So you're naming a feeling, allowing and accepting it to be present, investigating it, and then doing something really supportive and kind for yourself as you heal. And that's by Michelle McDonald. Research shows that nature can really help people who are depleted by stress, and it helps with the emotional strain of grief. Art has a positive effect, and there's a reduction in prolonged grief symptoms, particularly feelings of emotional numbness and life emptiness. Rituals. The research shows this offers structure, which offers a sense of meaning and control during times of loss when things feel very out of control. And personalized rituals can aid in emotional healing and psychological resilience. So this might mean waking up and meditating and then having a cup of tea and stretching the body before breakfast. So things that are personal to people that can help them to be present. Somatics, Qigong, Tai Chi, and yoga. We know that grief often triggers physiological responses like muscle tension, fatigue, digestive issues, and sleep disturbances. So these symptoms are linked to the body's stress response, and that involves hormones like cortisol and adrenaline, and we want those to be as calm as possible. The vagus nerve, which regulates many bodily functions, can be disrupted during intense grief. That really exacerbates physical symptoms. Unprocessed grief may increase the risk of chronic stress, heart disease, and immune dysfunction. Somatics support the physiological and mind-body connection. I wanted to include the immunological and physical impacts on the body that have come from a body of research and work from Dr. Mary Frances O'Connor. And this is specifically from her book, The Grieving Body. So grief triggers the sympathetic nervous system, the body's fight or flight mechanism. And that leads to elevated heart rate, increased blood pressure, and heightened stress hormone levels like cortisol and adrenaline. The gut-brain axis plays a significant role during grief. So the vagus nerve, which connects the brain to the digestive system, transmits stress signals that lead to nausea, appetite changes, and digestive irregularities. The immune system's efficiency diminishes during grief. And studies, including those by Dr. O'Connor, have shown reduced activity of natural killer cells, which are vital for combating infections. And so simultaneously, inflammation markers increase, making the body more susceptible to illness and exacerbating these existing conditions. So we can see how working with grief for those with chronic illness and IBD and CIRS, how important that is because they're already in a body that's experiencing a lot of inflammation, and we want to be able to really regulate their hormones, their nervous system to help them heal. Grieving individuals often experience sleep disturbances, including insomnia and fragmented sleep. This, on top of a body that might not be sleeping well because of those illnesses, is an issue that leads to more fatigue and more cognitive issues. And we know that grief disrupts hormone balances and decreases oxytocin, the bonding hormone. So that's really due to an absence of close physical contact when someone dies, but there might be that absence of close physical contact because someone is sick too. This reduction can intensify feelings of loneliness and distress, further impacting physical health. Dr. O'Connor emphasizes recognizing these physical manifestations is crucial. By understanding the body's responses, individuals can adopt strategies to support their healing, like mindfulness, social connection, and seeking professional help when necessary. All the things I pointed to in the work that I do and that people can access when they're going through grief. So what does grief look like over time as you recover and heal? It can really feel like you're oscillating between an old life and a new life, and people need support to process that. It can feel like a dance between two worlds where there's uncertainty about the next chapter. Grief can also mirror the waves in the ocean. So sometimes the feelings might be small and gentle, and other times the waves of emotion might feel very big and tumultuous. Sometimes people might want to go inward, reflect, and remember. And sometimes their most important thing you can do is move forward and begin new ways of being. It's often a dance between both. Grief comes and goes in waves and cycles, and special events may bring feelings of grief for people, and that's all very normal. I've included some resources here. One-to-one grief support sessions are something that I offer in my practice. So if you would like to have space to share your emotions and get ideas on how to work with the grief, then you can book in one-to-one sessions with me. If you have a CIRS diagnosis, I will have a specific course for working through grief beginning in November. It'll be the third time I'm running that course. It's 4 weeks long and very experiential. You work through the different modalities I touched on in this talk in community together. Meditation supports the nervous system, supports the hormones, supports the gut-brain axis, and I offer weekly classes in the practice portal. There are different membership options there. I have free meditations on SoundCloud, and I've included some somatic activities that people really enjoy, one called the butterfly hug, and some grief movement through Paul Denniston, who I really like, who does grief yoga. David Kessler has a great website, grief.com, and his book, Finding Meaning, The Sixth Stage of Grief, he has a workbook that goes with it that's also really nice. He was very collaborative with Elizabeth Kubler-Ross over time in his work, and a lot of things are related to the loss of a person. You can often see how that is universal and apply it to yourself if you're looking for some more resources. The Grieving Brain and Grieving Body by Mary Frances O'Connor are excellent books. There's an art therapy locator that I've included here, a place that does free improv on Zoom, and a Transforming Grief playlist that's also on Spotify. We all share the need for our grief to be witnessed, not for someone to take our pain away or reframe it for us, but to simply be present in our loss without trying to point out the silver lining. That's from David Kessler. That rings so true to me in my own experience, where oftentimes people might not know what to say, and I often didn't want people to say anything other than just to be able to sit with me in the pain, the uncertainty, and the difficulty of losing so much in a healing journey. And if you are somebody that has somebody in your life with CIRS or IBD or chronic illness, just remember best thing you can do is often be present for that person in the midst of this challenge so they feel less isolated. And if you are somebody that is going through this experience, just know that grief will ebb and flow and change with time, and that your feelings are very valid. And there are others out there that understand. So please reach out at any time for support, and I hope to connect with you soon. Here's the bibliography. Thank you so much, and I look forward to connecting with you in the future.